At week 6, we're continuing direct hip isolation strength. This is for hip flexion, adduction, abduction, extension, and rotation, okay, which is going to be a combination of, let's say, adduction and internal rotation, and abduction and external rotation. So we're starting to work those motions a little bit more, right? The reason why I have flexion and adduction bolded is because these tend to be the weakest motions for folks prior to going to surgery, and they're definitely weak afterwards. Okay. So we really want to make sure that we push flexion and adduction, and also keep in mind that flexion can be provocative. So we have to be careful still, but we do need to get this strength back. It tends to be a very forgotten muscle group, and we need to make sure we do improve that over time. Okay. We're still thinking about the accessory muscles, so quads, hamstrings, calves, core, all that good stuff. And what you'll notice is we start to phase out blood flow restriction training. So now we're doing it 1 to 2 times a week, whereas in the past we're doing it twice, and even more if the individual had access to that at home. Okay. So why is that? Well, I think a mistake is to think that BFR is advanced training. It's not. Advanced training is heavy loads, high speeds, sport specific skills, right? BFR is none of those things. Okay. So it's a nice adjunct at this stage to add a little extra strength and hypertrophy to a target area. But you have to keep in mind that as you get better and you get more advanced with rehab, we have to move away from this. Okay, so you'll naturally see that occur in my program. The other piece that tends to get forgotten is going to be balance. Okay, the reason being is that after you have a labral repair, the labrum has a proprioceptive function. It tells you where your hip is in space, and that's just been altered, right? First it was torn, now it's been repaired. So there's all sorts of funky information coming from the hip, and it's probably not in alignment with what the brain remembers, and we have to retrain that over the course of time. So we're definitely working on balance at this stage. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain-Free Mini Course. Definitely check this out.